My paper, Psychological Assessment of Gestational Carrier Candidates, Current Approaches, Challenges, and Future Considerations, looks at the issue of psychological evaluation for gestational carriers in the U.S. As the number of ART cycles utilizing embryo transfers to gestational carriers continues to grow, so does the need for competent clinicians to psychologically screen and assess potential gestational carrier candidates. There are increasing numbers of surrogacy arrangements, as well as increased numbers of mental health professionals conducting these types of assessments. Therefore, it's important to consider the ideal uses of data collected in these types of screening assessments. The current membership of the Mental Health Professional Group of ASRM is, as of January 2020, at an all-time high of 592 members. The goal of my paper is to provide all parties, mental health professionals, physicians, lawyers, agencies, and clinics with a deeper understanding of the purpose of a gestational carrier screening, an overview of current practices and challenges, and the best method to obtain the information necessary to make ethical decisions regarding gestational surrogacy arrangements. Here in the U.S., it's standard practice for mental health professionals to screen and counsel gestational carrier candidates for psychological appropriateness. Current ASRM Practice Committee guidelines for utilizing gestational carriers include a recommendation that gestational carrier candidates undergo a psychosocial consultation and psychological testing where deemed appropriate. These types of screenings typically include clinical interviews and the administration of an objective measure of personality functioning. In general, mental health clinicians conducting any type of psychological assessment have the task of answering the referral question by synthesizing multiple data sources as a means of aiding in clinical decision-making. Inherent in the request for a psychological assessment are several points of consideration. What is the question we're trying to answer? Who is asking the question, and how will the answer be utilized? It is standard practice among mental health professionals in the U.S. to administer different types of psychological tests when assessing gestational carrier candidates. The paper takes an in-depth look at the evolution of psychological testing in our field and discusses the rationale for using these types of measures. Over time, the rationale for the use of testing has developed more fully and includes liability issues, attempts to standardize care, and the importance of screening for both psychopathology and specific personality characteristics that could impact outcomes. The use of psychological tests represents a valid contribution to answering important clinical questions. And while some may see psychological tests as analogous to a blood test, where the extracted information presents indisputable facts and answers our questions in a definitive way, experienced clinicians understand the strengths and limitations of psychological tests and know this is not the case. Competent clinicians understand how to interpret and synthesize data collected from psychological measures as a means of answering the referral question. The final points of the paper point to recent research in the field of personality assessment that has shown that personality characteristics of individuals who may be either unwilling or unable to self-report accurately can be best assessed by a multi-method approach. The multi-method approach involves combining several tests for the purpose of developing a more comprehensive psychological profile. I believe that the consideration of a multi-method approach represents the direction we should move in regard to future research. Psychological assessment of gestational carrier candidates is complex, but an integral part of the consideration of a woman moving forward in this process. I hope my paper can help those who work in this field understand the role of the mental health professional and of the assessment process as a whole.